If you've been looking for help with your gut health and have spent years seeing different providers and specialists without any improvement, this video is for you. Irritable bowel syndrome, or IBS, is one of the most common and most frustrating GI conditions we see in practice. Bloating, cramping, unpredictable bowel habits. It can significantly affect your quality of life. It's important to understand that IBS is what we call a diagnosis of exclusion. That means before we land on that label, we need to make sure other conditions like celiac disease, inflammatory bowel disease, SIBO, or even a parasite infection have been properly ruled out. Once we're confident in the diagnosis, the real work begins. Nutrition is often the first place we start. And the good news is, even some straightforward changes can make a meaningful difference. Things like eating regularly scheduled meals, staying well hydrated, limiting caffeine, alcohol, carbonated beverages, and prioritizing consistency are all important. If those foundational changes aren't enough, the low-FODMAP diet has the strongest research behind it for IBS. FODMAPs are a group of short-chain carbohydrates found in things like wheat, garlic, onions, and certain fruits that can trigger symptoms in sensitive individuals. The low-FODMAP approach isn't meant to be permanent. It is employed in 3 phases: restrict, reintroduce, and personalize. A nutritionist familiar with this approach can be an invaluable guide. One more thing on fiber, it's nuanced. Soluble fiber, like psyllium, can be helpful, especially if constipation is your primary symptom. But insoluble fiber, like bran, can actually make things worse. So go slow, pay attention to how your body responds. What about the microbiome? The trillions of bacteria living in your digestive tract play a role in IBS, and while the science is still evolving, targeted probiotic support can help. Research includes the following conclusions. Multi-strain probiotics tend to outperform single strains. Specific species like Bifidobacterium infantis, Lactobacillus plantarum, and Bifidobacterium longum have good evidence. Shoot for at least 10 billion CFUs per day, and you need to give it at least 4 weeks before deciding if it's working. Individual responses vary, so some trial and error is normal. Next is a somewhat surprising factor in IBS, the mind-body connection. Your brain and your gut are in constant communication through something called the gut-brain axis. Stress and anxiety don't just live in your head, they directly influence how your gut functions and how you perceive pain. This is why behavioral therapies are now considered a core part of IBS management. Cognitive behavioral therapy helps you identify thought patterns, like catastrophizing or hypervigilance to gut sensations, that can actually amplify symptoms. Gut-directed hypnotherapy is another surprisingly well-studied option. It helps the brain regulate gut sensations more effectively. And don't underestimate relaxation practices. Deep breathing, progressive muscle relaxation, and mindfulness. These aren't just stress relievers, they're symptom management tools. Managing IBS is rarely a straight line. It's a process of trial, refinement, and learning what your body responds to. The integrative approach recognizes that. No 2 people with IBS are the same, and your plan shouldn't be either. Start with your provider, get the right testing done, build your foundation, and know that with the right combination of tools, most people with IBS can get significantly better. Thanks for listening. Take care.